Hello, my name is Dr. Dina Hushar. A diverse group of VA and non-VA innovators joined forces to create a quality improvement demonstration project called the Help with Employment Agency Risk Transitions and Housing Project. The aim of the HEART project is to adapt current transfer of care processes from the Department of Defense to Veterans Health Administration post 9/11 transition and case management to proactively identify and serve veterans who are at high risk of experiencing negative military to civilian transition outcomes, such as homelessness, unemployment, and/or suicide within their first 12 months of military separation or retirement. The HEART project accomplishes goals by developing and merging multiple innovations. One of its innovations is a predictive analytics model that identifies these high-risk veterans even before they register at Veterans Health Administration for care.
Another HEART project innovation is the National Call Center for Homeless Veterans, making outbound calls to these predictive analytics model identified high-risk veterans. The first time that the National Call Center for Homeless Veterans has proactively called veterans to offer them help is with the HEART project. Typically, the call center receives inbound calls from veterans who are already experiencing homelessness or feel that they are at risk for experiencing homelessness. Since February of 2023, the National Call Center for Homeless Veterans has called 2,904 HEART-identified high-risk veterans and reached 1,079 of them. One veteran who was contacted by the National Call Center for Homeless Veterans shared they were immediately interested because when the veteran first got out with the TAP program, it felt like the checkbox versus help. This veteran stated, by the time the National Call Center for Homeless Veterans contacted me, it was 6 months since I'd been out and I knew I needed help. The National Call Center for Homeless Veterans team members felt such purpose in the work they did with the HEART project and truly believed in the goal of the program. The HEART project team operated with creating a caring atmosphere of trust, respect, and inclusion for veterans that put the VA's iCare core values and on-the-moment principles into action.
The core element of the HEART innovation is a 100% virtual national clinical team that provides HEART-enrolled veterans up to 6 months of care coordination and case management services to achieve goals that matter to them and link them with VA and non-VA services for long-term care. Compared to the general veteran population receiving VHA care, having unstable housing or a positive Columbia Suicide Severity Rating Scale score is 11 and 9 times respectively higher among HEART-enrolled veterans. After receiving HEART services for 3 months, veterans' needs significantly decreased, and a number of veterans became stably housed, enrolled at their local VA, established care with a primary care provider, became employed, and reported a decrease in suicidal thoughts. Veterans reported feelings of being more connected to their civilian community and having a renewed sense of purpose in life.
Imagine a woman fishing peacefully by the river when suddenly she hears someone shouting for help by the water. She quickly pulls them to safety, only to hear more cries for help. Time after time, she rescues those in need. Determined to find the root cause, she heads upstream and discovers a broken bridge with missing planks. With dedication and care, she fixes the bridge, preventing anyone else from falling into the river. As a HEART project social worker, I get to be that woman, ensuring high-risk veterans whose average age is 24 years old have a smooth and positive transition. This younger population has unique needs, and I am there to support them every step of the way. Like one veteran I worked with who moved multiple times in 6 months, he faced challenges like finding housing, navigating homeless resources, setting up utilities, and creating a budget. Now he's welcoming his first child and building his first home. Through every move and every challenge, I was his constant support. Together, we're making a difference, one veteran at a time.
When I think of this project, I think of my social worker, Wendy Park. When she first called me, I was not sure what to expect from the VA. I was not sure that the VA had my back. I could relate to Wendy and I felt comfortable talking to her. She helped me to organize my life by helping me set goals and giving me weekly tasks to do. I registered for nursing school, got my finances in order, got housed through the Transition in Place program, and I got my service connection. I am grateful for the HEART project because it has motivated me to do what I need to do and to have a better life.
The Hearth Project innovators would like to thank Veterans Experience Office for acknowledging the Hearth Project and are owning the moment not only by preventing negative military to civilian transition outcomes amongst the high-risk veteran population, but are supporting these veterans who are in their 20s on average to achieve their full potential.